3. Sorry for the late start. And we will start with attendance, if you would be willing, Amanda. Thank you.
Yep. And just a reminder to everybody, this meeting is recorded and will be posted on our website with the other meeting materials after the meeting is done. And the only other reminder is just to please keep your microphones muted if you're not speaking. So Senator Hansel, I didn't see him. Morgan's here. Rob Bovette. Courtney Moran.
Yes, present. Good morning.
Good morning. Matt Cyrus.
Yep.
Jane Oler.
Present.
Amanda Metzler.
Present.
Brent Kenyon.
I'm here.
Andre.
Present.
And Steve Marks.
Here.
All right. So did everybody receive the agenda? Unfortunately, it was posted last week. I forgot to email it to everybody, so it should be at the top of your boxes if you haven't had it yet. Have a chance to look at it. So we've just kind of framed out the considerations with some pointed questions for group discussion, which within each one of those considerations. And so, Rep. Morgan, if you want, we can go ahead and just get started with the first, which is the sales to minors.
Yes, please. I am going to end up logging off and trying to get back in here. Everything is frozen on my screen, so I'm going to try to, so if you would be willing to, so we're going to first start in just looking at the questions and if they're appropriate, or are we actually going through the discussion and talking about where that is right now?
I think at least for the first one, we could go into the discussion.
Sounds good.
That works. All right.
Go ahead, Amanda.
Okay, great. So the first question you can see is methods to prevent sales to minors of industrial hemp commodities or products that contain intoxicating cannabinoids. And so currently OLCC has rules in place, and I've given a shorthand example of what those rules are. And so for the group to discuss, is that acceptable limits to place it on THC that minors are able to purchase in Oregon? And so any thoughts on the current rules are welcomed. And they've been in place since last June. Okay, so are the current rules, does the group think that they are acceptable, since nobody has any comments generally around what the current rules are?
Are you guys accepting comments from people outside of Oregon?
Not at this time. We do public comments for the full task force meetings. This is just a subgroup meeting for the task force members.
Not at this time.
Okay, so then the next part of that question, basically, is there additional authority needed for ODA or OLCC to enforce the sales limits? So currently OLCC can impose a civil penalty of no more than $10,000 for a violation of the sales to minors.
Amanda,
Yes,
I had a question.
Oh, go ahead, Amanda.
Okay, thanks. What I was going to ask is that like a minor decoy program to be able to locate the people who are selling to minors? Is there something that needs like additional for ODA or OLCC for that aspect of it? Like how is the enforcement happening to even catch it? Is it complaint driven, like normal, or that's kind of what I was asking?
Yeah, at this time it would be complaint driven. I don't believe we have the authority for a minor decoy program like we have for marijuana or for alcohol.
Is that something that OLCC would find helpful to have in finding those people who are selling to minors, or is there another avenue?
I think this is one where probably there's another avenue since it's retail. You know, we need I think, a more systemic compliance effort around this, you know. So some of the discussions about packaging, labeling, and how that comes to a retailer will definitely help the market, you know, be more certain. So I'm not sure exactly who should be really enforcing a retail with all of these things, but it seems like, you know, what we did during the session was to get it away from kids and to give some enforcement, you know, powers and level for sort of mostly complaint-based work right now. No one's really out there enforcing. And it seems like we need a more systemic compliance effort for retail to happen. Something that's easier, quite frankly, for the manufacturers of hemp to know they're getting products there, and something more readily acknowledgeable by retailers themselves on what products they're selling so they can understand it. I think that's open to discussion about how you do this. You know, this isn't the only place in retail stores we have the problems. The internet is a huge problem for a variety of CBDs, marijuana, liquor, you know, and how you actually provide enough oversight for that, which is, I think, a huge issue, probably beyond our scope, but really related to this as well.
I see Andre's hand, unless Samantha, you had further follow-up on that.
I did not, thank you.
Sorry, two Amandas.
Thank you, Rep. Morgan. My question is just for clarification. Are the rules applicable to just OLCC licensees or anyone selling these products in Oregon?
It's anyone selling the products. So this
I
is,
mean, yeah, go ahead. I'm sorry, Amanda.
I was just going to say, this is a lot of the high THC products that were based from hemp products that were in grocery stores, convenience stores, those type of things.
I mean, to answer the first two questions, I think yes. I don't know what additional authority would be appropriate. I think the fine is the penalty fine up to 10,000 is certainly appropriate, in my opinion. And then should be resources be given for public outreach? I would say absolutely.
Great, thank you. And I see Matt Cyrus, you have your hand up as well.
Yeah, I'm just curious, devil's advocate. What's the THC concentrate in total in, say, hemp garments, etc.? Completely unrelated. I know we're targeting the CBD type products, but just how encompassing is all of this, and what it includes some of the other things as well.
And Matt, you kind of cut out a little bit. Were you talking about garments, like a hemp T-shirt or something like that? Is that what you said?
Yes. I mean, everything that's got a cannabis content is going to have some small amount of CBD, THC, and all of the other compounds. My question is, what is the total amount? If we've got a total per product limit, just throw, like I say, devil's advocate, what's the amount in, say, a T-shirt?
No, I don't know.
Stephen Crowley's got his hand up. I don't know if he's trying to answer that.
Yeah, just to be clear, the THC limit applies to cannabinoid hemp products. It does not apply to grain or fiber products like garments.
Perfect.
Now, if you start selling edible clothing, that might change, that they have to come up with additional regulations. So just saying.
Sounds like fun. Okay,
so as it is right now, I would ask, OLCC enforces for sale of alcohol to minors. Do you enforce the cigarettes, or is that through Oregon Health Authority? So I guess my question would be is how does the fine compare to other products and the enforcement process? What if it's not a OLCC retail establishment? What if it's private sales? Usually that would be law enforcement and in dealing with sale to minor outside of a retail establishment. I guess if you could provide a little bit more clarity on the other products and how they're enforced would give clarity to this.
Andre, you have cigarettes, right? Oops, sorry. You want to talk about that?
Yeah, I don't have the portfolio for tobacco retail licensure yet. I'm sure some people in OHA would like to give it to me. But yes, OHA will enforce tobacco retail licensure. I'm not sure the civil penalty issue. I think it's pretty similar, but I can ask the folks that handle that and get back to the subcommittee. But I'm pretty sure there's a tiered civil penalty enforcement that probably goes up to $10,000.
Any other comments on that as far as outside of retail establishments, enforcement issues? I see all the OLCC, wheels turning, but maybe it's the lack of beard, Steve. You need the beard back so we can. No.
Yeah, just affected my synapses. So I'm not sure about the outside of retail. Our retail are primarily those. I think where we cross over is those that sell beer and wine retail outlets. Grocery stores, convenience stores. We certainly do compliance efforts at those on occasion. It's not very systemic in what we do. A lot of our work is complaint based when we're looking at those retailers, but we do some systemic work. Part of the slowness there is we haven't done anything in a while because we wouldn't subject minors to COVID. So we haven't actually done any operations for all of the duration of COVID, and we still haven't really reestablished those operations, but we'll be doing them again. So that's what we do. I think it's probably we could think about a compliance effort on a similar vein. I have to say right now it's been actually we've just shifted to paying minors. We've never got to implement that. You gave us a budget for it, the legislature did, because we weren't getting the consistency and volunteers to do this work as a minor. But I think we could do that work. That's an option for retailers. I also think, the option, we can work with OHA and others on how we look at compliance on, across the scope of those products that sit in sort of our common retailers.
I have Brent Kenyon, then Amanda Metzler.
I guess I'm just curious if the thought was that OHA would be potentially responsible to add that on. Was that the suggestion? Or
no? I don't want Oregon
No?
Health Authority adding any more enforcement. I want them to be medical. They have too many things, and enforcement branch is not really their wheelhouse in that, in my opinion, from dealing with them on many other issues, from ambulance service agreements to the tobacco programs and everything else. It's not really their wheelhouse.
Yeah, I think there's so many places, besides online, just every I mean, a lot of the places have in common that they sell liquor, I think, in the minute market space, but there's a lot of CBD retail and just people's cheeses. You can see it at Marshall's. And I mean, there's places where CBD's popping up on shelves that seemingly would be impossible to, from a regulatory standpoint. I'm just curious, I guess what that looks like.
Amanda, good questions, Brent, by the way.
Yeah, I was actually I had a follow-up for Andre. Does the Oregon Health Authority for Tobacco, if you're going to sell that, they have to register with you? Like, what does that process look like? Is it a verification, or how do they sign up so they say that they're going to be selling tobacco?
There's now a licensure requirement for all tobacco retailers. So it's like anything else, like selling liquor or cannabis, you have to apply and get a license from the Oregon Health Authority. And then there's inspections and compliance actions as well.
So Representative Morgan, I think that follows up with what that missing license type is in that supply chain for CBD products, that it seems as if there needs to be a similar licensure for selling CBD products than it is for tobacco. So there's a register of where these products are going. I mean, Andre, do you think it would be a different setup for that, or do you see some flaws in how the tobacco model works?
I mean, I don't have much knowledge about how the tobacco knowledge works, but just my general knowledge of licensing and compliance and enforcement. I mean, a licensure program is pretty burdensome on any agency and is going to get expensive. So you would have to have licensure fees. So any retail location, whether it's a grocery store or a convenience store, would have to pay those to sell cannabinoids, to pay for the agency's actions. So I don't know. It's a really good question. I mean, I think that if it can be done without complicating things and having a licensure program, then that's great. But if there are gaps that we continually fail to see, or if there's continuous public health and safety problems, then maybe a licensure program is worth it.
Thank you.
Well, and I think that kind of goes back to the conversation we had last time of making sure the labeling is accurate for what is there. Do we need a license for a CBD product that has zero intoxicating compound whatsoever, right? Or is it if there is an intoxicant level in it, then that requires a tiered program maybe, or something to address which, but if there's an intoxicant, it's appropriate to go through the OLCC program. And if there's not an intoxicant, that's when it's ag of sorts, or that process. So I guess that would go back to the previous question as well, as our clothing THC. Well, if it is, it goes through OLCC. If it's not, I mean, where's the intoxicating level of where things are at? And so I guess that goes back to this question. Are the current OLCC rules acceptable? Are there additional resources or authority needed for ODA and OLCC to monitor intoxicating substances? And Sunny, and welcome. So glad you're here today.
Yeah, thank you. I was just going to throw out, it might be worth having somebody from the I think it's Utah Department of Ag, come talk, because all hemp products have to be registered. They review all of those products. And I can't remember, but they may license the retail facilities as well. And so they might be able to provide some feedback on how that has worked.
Does Utah also have like an OLCC version, or do they just have this one version? So they have one agency doing it. It just happens to be how they're doing it.
They don't have adult use marijuana in Utah.
Oh, sure they don't. Okay. Any other comments on this one, Amanda? Or
only the last question was just about resources for outreach. I don't know if the group thought that would be an acceptable way to basically let retailers out in the general market know that there's limits for children. When we first set the limits, OHA ODA and OLCC did some joint press releases on it, but that only goes so far out into the Oregon marketplace. So that was just the last question. The people thought that it would be worthwhile to invest some sort of funding so that there could be some actual outreach.
I'm not opposed to that. I think I would question that coming first before having all the everything else in place. And maybe getting things in place, and then, I mean, how much of it does it need to be an outreach versus already within the budget of OLCC in the regulation, in the getting a letter out to retailers of updates? And I don't know, I'd be questioning that, but Director Marks, go ahead. Can't hear you, Steve.
Sorry, I clicked down my hand and on my mic. I was going to say a similar thing, maybe some modest effort now and a modest amount, but I think when we look at how we're going to regulate it, package it, market, if we're going to go that direction, it makes a big difference in the kind of communication you need to do to get it in the marketplace and to help retailers understand. I think my difficulty with the current system is it's so retail dependent right now to know what's going on. You got to read a COA, you don't know about it. Frankly, I'm not very good at reading those. I can see they tell me they don't have really THC in them, but I don't really believe them, and I don't know what they tested for when I look at them, and I don't see the comprehensive nature. That's not, from a consumer point of view or some poor retailer trying to interpret that. I think you'd always say yes, but I think if they had some certainty in the marketplace, the kind of effort then we need to do for non-intoxicating CBD, I think the threshold goes way down. If we do some work to, lack of a better term, certify those products going in the marketplace.
I see Matt's hand, and then I don't think I have anybody else waiting.
Yeah, I guess I kind of go back to what we talked about a week or two ago with labeling. I mean, you look at any grocery store and you've got literally dozens and dozens of different products on the shelf, and they may list how much CBD is in them, but they don't tell what other cannabinoids or other potentially intoxicating products are in them. You have no way of knowing what's in the product. You don't have labeling requirements that require what is actually in that. The only thing anybody ever labels is the CBD part. And, it may be something we need to start with the very basics of labeling and what's in it. And then the other question is what kind of products are we covering as far as access to minors? Is everything from massage oils and pain sticks or is it just the edibles that, someone is expected to ingest? You need to maybe back up a step or two and figure out how we identify what it is we're selling, and then how do you deal with the internet and everything else coming from every other state? Because quite frankly, I mean, if you go on Amazon, you can find labels that are crazy that there's no way they are any semblance of reality, some of the claims they're making, but like I say, back to the basics of what's in it.
Matt, I think that's really valid. And we talked about that in our previous meeting about the need for having labeling be very clear of what it is, and not just labeling of, hey, this has less than 0.3 THC, or it's got CBD, or blah, blah, blah. It's per serving or this and that. And sadly, what came to mind when you were commenting was expected to ingest. Well, what we've learned from teens in society right now is you can't always limit it to what's expected to ingest. Who would have ever expected anybody to eat a Tide Pod? And so
no shit.
Okay, yes, thanks for saying that out loud.
Sorry about that.
You might want to mute. But that's it just came to mind of we can't put by anybody what anybody will ingest these days. And so making sure that labeling is labeling, period. And, you know, some of the conversation we had about Delta 8 THC was, how is it processed? How do we guarantee that the processing and how it was made? I had somebody locally telling me about, oh, to make RSO, all you got to do is blah, blah, blah with some Everclear, blah, 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 blah. And anybody can make RSO. And it's like, well, don't we want to know that whatever the product is it is meeting a standard of, you know what you're getting, you know what you bought, and it's safe to consume because it's had a standard, and that's what our professional groups have been trying to meet. So out of this, the goal of the subcommittees would be to make recommendations of any potential legislative recommendations back to the full group. And so as we're asking these questions, is additional authority needed for ODA and OLCC to enforce the sale limits? It sounds like the first place is, do we have the labeling in place? And we need to make sure that if there's legislation to be recommended, is that we have labeling be required for serving size, for exactly what's in it, not just CBD, THC, but any intoxicating substance, that the labels be accurate. Is there something I'm missing from those of you that remember the last meetings, or does that seem accurate to answer the question at the moment? I see one head nod, but I don't know if that's when it's just initials, you can't tell what people think.
And Rep. Morgan, there is a specific question in the third set of considerations that talks about labeling as well. So that is.
Okay, so we'll get to that
separately.
then. So let's, all right. So looking at, there wasn't comment on if the current OLCC rules are acceptable. I did hear somebody saying they're out of state. Currently, that's not really, I mean, that could be provided in public comment, or you can email it in and we can submit it to the group for consideration. But as far as OLCC authority, it's within the state. And so, and then the second one, additional authority to enforce sale limits. Is anything needing to change there currently? I didn't hear a recommendation, though. Andre offered to come back with what they're doing. So.
Yeah, I sent that question out just now to the program, so I'll wait and see if I get a reply, but I can get back to Amanda if it's after our call today.
That would be great. And really quick, I'm going to go ahead and mute all really quick just to get rid of some of this background noise.
It's jointly and severally.
All right.
Okay, thank you. All right, so maybe we'll revisit that after Andre comes back and we just look at, is there any tweaks need to be there? And finally, any additional resources for outreach? I think outreach is a part of things already. It should probably be included in regular day-to-day stuff, but we can revisit that after we look at any regulation changes to see what the need specifically is. I think it's too soon to answer a public outreach because we don't know what the cost would be and what the requirements would be. So unless anyone is raising their hand and saying otherwise, we can move on to the next question. So the second question, testing requirements and methods of enforcement of testing requirements for cannabinoids, including artificially derived cannabinoids, to protect the public health and safety. Questions related is additional authority needed to enforce the existing testing requirements for hemp products? And are additional enforcement resources needed for agency staff to ensure compliance with hemp product testing requirements? Sunny, I'm glad you're here. We had some questions about where we were with testing in general, from where things were at based on House Bill 3000 and testing requirements of plants, testing requirements of products and such. So I don't know if this is something that you want to start out with and just kind of speaking to where things are at right now. And then any other questions we can come up from there.
Absolutely. Good morning. For those who may not know me, I'm Sunny Summers. I'm a senior policy advisor at the Oregon Department of Ag with a focus on hemp and cannabis policy. So right now, over the last 2 years, especially since House Bill 3000 has been passed, the hemp program's focus has been on stabilizing the growing portion of the industry. We did Operation Table Rock last year, and we're doing a similar project actually all over the state this year. That actually started last week up in, I think, the northwestern portion of the state, and it's going quite well. We want to thank our partners with OLCC again for helping provide some additional staff and the light lab equipment that we're using to do the presumptive marijuana testing. You know, a lot of that is due to the impacts to local communities and the environment with folks who may have been trying to hide behind a legal hemp license and not actually using it for the appropriate activities. We have had testing requirements for hemp products, so not the pre-harvest, but everything that happens post-harvest. Since 2018, the legislature at that time required that all hemp products be tested the same as marijuana products if they were for human consumption. So inhalation, applications to skin or hair, or ingestion. And so while those requirements have been in place, it's been difficult for ODA to know how to staff this program. As I think you're all probably aware, we saw a really large increase in license numbers back in 2019, 2020, following the 18 Farm Bill, but we're down to less than half of what we had last year. So while we're doing the growing portion, we do anticipate shifting during fall and winter to start looking at the initial processors known as handlers in the hemp program. Right now, those are the two licenses that we require, is grower and handler. We're looking at adding any secondary processors through rulemaking this year that would go into effect January 1st. And I would remind you that currently this program is funded by license fees. So that has been an additional piece of this process, is trying to make sure that we have sufficient fees to cover the activities that the department is doing. So we will be looking at those license fees as well this year to help cover that increased enforcement work. So hopefully that kind of answered your question, Rep. Morgan. At least gave an overview.
No, I appreciate that, Sunny. It did bring up a question that I have, and others may have more questions as well. When you say fees to cover activities, and this kind of goes to essentially when the Farm Bill went through and the initial fees were established, it was for growing hemp and hemp essentially, what is it being used for, and product intent, I guess. But there's not really a licensing or a fee coverage for the processing and the retail portion of it and the enforcement of that. I mean, right now the fees kind of been towards the growing, the agricultural side of it. And so my question would be, is kind of what was mentioned in another section, is a secondary licensure needed for the products that are produced from hemp for sale and retail, or for testing, or for the labeling, that process. Is that, or is it enough to just look at the ag, or does that fee need to be increased, to cover that process? So where is the process of the fees matching the activities? And are there more activities that are a result of growing hemp than were anticipated when the fee structure was created?
Certainly. And just to clarify, the initial processor, whoever receives the raw plant material and turns it into something else, is required to have a license to date. And so those handlers are licensed, but I agree that the secondary handlers or processors, anybody who's receiving, for example, an extract or a concentrate to then convert into a gummy, a lotion, a salve, they're not currently licensed, nor does the state require any specific record keeping of that entity. And so that's where ODA is looking to add that additional license requirement. House Bill 3000 gave us the authority to create that license requirement. And now that we kind of have the presumptive marijuana piece in rule and in practice, we can move to adding that secondary processor license. And like I said, during the off season, so to speak, right, when other than indoor growers, when the outdoor growers aren't growing, we can shift our enforcement staff to start looking at the records of the folks that are handling the plant material and making sure that they're doing the testing and meeting those requirements. The retail portion, that as we've talked about, that's kind of nebulous, right? And we've struggled as a state, and I think as a country, to deal with some of these products because we don't have that federal framework that we would have for other products like this. So we're kind of having to create that at the state level when normally we would have a federal framework to work from.
Thank you. Are there any questions from the group? I see Bo, go ahead.
Yeah, I was just curious.
I'm sorry, Bo, my apologies. It's task force members only.
But if you did
Okay.
have comments, Bo, you can go ahead and send them to me via email. Anybody can. And then during the full task force meetings, we have a whole section time for public comment.
Okay, yeah, thank you.
My apologies. Any task force member questions?
Hey,
Brent,
Sunny,
go ahead.
it's Andre. I was wondering if you could, if you had information, provide a little bit of info on a reference laboratory and maybe its role in helping with compliance activities.
Great. I'll take a stab at that, and I may look
Sorry,
at
it's a little
Steve.
bit of a loaded question.
Look at Steve for that as well. You know, we've been talking about a reference lab in the state for a few years now. I think, you know, the idea being similar to what we see in food commodities, for example, fresh market produce. Primarily, the framework that ODA is thinking about from a reference lab standpoint, and we've talked with Olcc about, is the idea that you go purchase products off the shelf randomly from stores, randomly products, and then have a lab that the state has established as being the lab, right, the reference lab, to run those products for things like pesticides, potency, and determine if what they have on the label and what they have on a COA that they provide is accurate, right? And there's going to be a little bit of plus or minus because every lab is going to be slightly different. Lab tests are never 100% exactly the same, but you know, within a certain tolerance, which is built into the rules, are those products meeting the requirements? And I think we would love to see that both on the marijuana side as well as the hemp side. And so there's going to be a budget ask in the 23 session to help create that reference lab. ODA is part of the North Valley project, and we're actually moving all of our labs, including our lab that would do that kind of work, to the North Valley so that we have additional space. And part of that budget ask is asking for an additional piece of equipment that does that kind of work, as well as the staff to do it. So I think from a retail perspective, that will be a really good deterrent because you don't know if your product is going to be the one that's picked. And you know, we see that again, looking at a national framework that has worked quite well in the fresh market produce. FDA says, okay, we're going to pick onions this year and go test onions and look for, are they, you know, within tolerance levels for pesticides, for example, and you don't know if your onion's going to be picked or not. So Steve, I'll let you jump in because you probably have better, more eloquent things to say about the reference lab, but I thank you, Andre, that's a really good point.
No, I think you did a great job, Sonny. I just think, we're making the investment. I think we're gonna transfer. I'm not sure we got it all set up yet, but about $2 million of licensing fund over to help ODA get some equipment. I think this time, some scientists in place, get that FTA going, and then we'll work on our cost per test, I think, into the future and how we continue that relationship through maybe intergovernmental memoranda. But we really wanted it to test our cannabis products against our standards, right? At a minimum against our standards. And that's the one thing that this reference testing can do when you go out and actually are looking at the final products. I think it'd be a lot more effective, quite frankly, than a decoy program to go out and pull some products off the shelf and see what their THC is on the CBD side. Once we figure that out, I hadn't really thought about it being used on that side of the equation. But this joint venture that we have going, I think might be, it'd certainly be conducive to making that kind of work happen on both sides of the equation. So,
and using those new staff to check lab methodology, so that hopefully we improve the work coming out of the private labs as well.
Thanks, Sonny and Stephen. And I've been part of that squeaky wheel about a reference lab for 30 years now too, but really happy to see that there's some movement and funds towards it. So thank you.
Brent, then Amanda Metzler.
Thanks, Rob Morgan. Sonny, I was just curious if there's any idea around, as far as having people's, the labeling is great and all of that, but are we, thinking about places that are making hemp edibles, for instance, or hemp ingestible products, having to have some of the same standards as far as weights and measures, scales that are checked by the state, as well as, some of the cleanliness issues in the kitchens and the things that we all have to go through to have our edibles kitchens now. Is there any work being done on that, or is that something that I think would be super important for folks that are making these products? Obviously we can order anything online. It's going to be hard to monitor that, but as far as what's made in Oregon, I think besides just testing.
Yeah, thanks, Brent. That's a great question. They've always been subject to those same requirements. So, if we were to find out that a facility doesn't have a food safety license, for example, those are the staff in the program that does all basic sanitation associated with food manufacturing in Oregon. They would be subject to our food safety program. And our weights and measures program has been working with folks from the very beginning as well. So that's already been in place. There's very specific laws, just like for you on the marijuana side, that say that hemp or marijuana are not to be considered an adulterant in food in Oregon. From the very beginning, both sides of that coin have been subject to the same requirements.
Great.
It's me. Sonny, I had a question for you. I believe in the HB 3000, it said or instructed ODA to create a track and trace program. Is that correct? I was wondering if you could speak a little bit to where that is in the process, or where you see that going forward through the ODA.
Thank you. So the tracking piece was limited to, it was weird because it didn't maintain the same definition for human consumption that has been used in the past. So it excluded products that are applied to skin or hair. It just applies to ingestion and inhalation, if I remember correctly. And so that's going to be part of our current round of rulemaking, is to implement that tracking piece as well. But just to put that out there, that for some reason, it changed the definition of human consumption specifically for that tracking requirement and didn't include kind of all three pieces.
So just ingestibles is what that includes.
And inhalation.
And inhalation. And are you guys planning on using, making up a new tracking system? Or, some tracking systems already seem to exist instead of reinventing the wheel. Where do you see that going?
Yeah, we haven't finalized that So, that's up for discussion. I think there's a large likelihood that it'll end up being some portion of metric, and working with Steve and other staff at OLCC to figure out how to make those two complementary.
Thanks.
Director Marks?
Yeah, I was just hopping in here to say, yeah, we're looking at this too, and Sunny's part of the rules and how we look with metric. We're actually under some look at what we're doing with metric as well. But I think we got to think about, I've been an advocate for synergy and efficiency in how we regulate cannabis, and to centralize sort of the work, the look at processing, the look at how you track and trace and how you know where consumables are going, either the open market or not, or something where I believe, and OLCC will be advancing ideas, and Sunny's aware of this, and we're going to have to integrate how we centralize, I think, that function, and how we integrate our separate responsibilities into more a singular system approach here, to get us from here to there. So I didn't want to surprise anyone, and I think that really is the reason why ODA and their rulemaking, we got to match this up eventually. They'll be a little bit ahead. Might be a little bit off, but they need to do something maybe under rules, and then we'll iterate up, unless the legislature acts much more swiftly and surely in February to say, oh, here's where you're going and do it this way. We're going to have to take a little bit of time to move the resources, figure out what we want as state policy to integrate. But I think it's absolutely vitally important that we do that, but especially for consumables. So, not fiber, Mr. Cyrus.
Unless you're trying to eat it. So I guess my question with that would be, is any legislative changes or recommendations needed, or is this something that can happen through rulemaking?
I think it can happen through rulemaking, as long as those are the products that you're wanting to track.
Okay. Any other questions? Director Marks, your hand's still up.
But I would just say I got a different answer. I think we need it through legislation and rulemaking. So, but I think that rulemaking is sufficient for what's in 3,000. There's no doubt about that. It could be, if we change policy, then we'll probably need legislation to help us coordinate that.
Exactly.
Group, what do you think? Do you feel you have the answers as far as testing requirements? I think that I heard that we need reference lab to be something that is supported. I think that would be appropriate for a recommendation. I'm looking for objection to that. I think that is something that statewide for all products related to cannabis plant, a reference lab independent would be appropriate. And is anybody objecting to that recommendation? Is everybody in agreement that that would be a recommendation back to the full committee? I'm seeing some thumbs. Okay. Now Sunny, go ahead. I had a question for you next anyhow, so go ahead.
Oh, perfect. Real quick on the reference lab, I know way back in the beginning, like 2016, 2017, there were concerns because ODA is not ORLAP accredited. So I wonder if that needs to be included in the legislation, that ODA is the reference lab regardless of their accreditation. I would argue that we're accredited by a number of bodies and probably to a higher standard than the ORLAP accreditation, the private labs. So that might be an additional piece of the legislation around that reference lab that you might recommend.
So what I've seen in my other subcommittee is that we come up with, LPRO has been on the other committee. I don't know who that would be here to make the recommendation wording that we would look at and try to get consensus before sending back to the big group. So any of those pieces that need to be included, let's have the specifics that we would send back to the big group, if that's okay. All right. I see Jay.
Yes, good morning, Representative. Marsh, the on with respect
Not
to
Marsh, but it's okay.
I'm sorry. Yes, sorry. Anyways, the issue of the labs and such, of course, with ODA, we know with the private labs, a lot of it also comes down to standards and the Drug Enforcement Agency, DEA. And so I think in any of this, certainly saying that we want to see a state reference lab, but we also want to carry along with that it, of course, ORLAP, I think that sounds wise, just making sure that they're the right one. But I think we need to also see that there's federal alignment, and then also specifically talk about what standards is the lab going to use, and is that because there are many different sources, and that itself can wobble labs all over the place.
Thank you. And Sunny, I see your hand still up. I didn't know if you're responding or if you, okay. Those are good points, Jay. Thank you for that. Matt, I'll be with you in just a second. I wanted to, Sunny, you mentioned the track and trace program that you guys are getting to it in rule making, or do you need more legislation? And what time frame do you think that ODA will be able to get to in that?
So we can do rulemaking to implement what is in House Bill 3000. So as long as that is what the legislature asks us to do, we can certainly do that with current rulemaking. We're having our first Rules Advisory Committee later this month, and it would kind of depend on working with Olcc and the contract with Metric, if that's the way that we end up going, for when implementation would take place. I tend to like to implement on the calendar year because that's our licensing year, but something like the tracking could be implemented mid-year and wouldn't be as detrimental because folks wouldn't necessarily have a license that have to use the tracking system.
I think legislatively, it'd be great if the rules were done in time for us to have a response next year. Did we hit the mark? Is there still more we need to do? That kind of thing. Matt, go ahead.
Yeah, with regard to the reference lab and some of the testing, I think I brought it up at the last meeting about the need for some consistency, and I mentioned that at our Hemp Association board meeting, and one of our board members is a lab person, and I got quite an education on the differences and why a lot of what I was suggesting wouldn't work. And it might help if somebody like that were to address this committee on all the intricacies of the testing process and why different labs with the same material end up with different results. It sounds like the testing process, the margin of error within that is such that somebody could end up going to jail on material that was legal to start with, and until we can figure out how we can get consistency and consistent numbers, kind of everything from labeling to everything else goes out the window. But it sounds like it's a lot bigger problem than any of us realize in getting testing that is both consistent and accurate.
I appreciate that, Matt. There was a request to have a lab present, and I think we would want to invite whoever is kind of industry lab wise. So Amanda and I, in looking at the agenda, I didn't have time to get that on today's agenda, but we do want to bring that back at the next meeting. And so that we do have that intent. So it wasn't something I was able to get to today, and I apologize for that, but I appreciate the recommendation. Okay, so of what we heard on the testing, before we make a recommendation, I think it was very good discussion, but also getting the lab presenters next time. Then it would also be based on what we heard on the reference lab. It'd be nice to get some generic language that we can get back to the group, so that after we have the lab present, we can see, does the language that we've recommended meet the need? Can we move forward? We're going to run out of time pretty quick. So we want to just keep things moving simultaneously. So any recommended, as we're going through, any recommended legislative changes that this task force would take back to the legislature, then we can also inform those as we go. So it's not finalized until our big task group as a whole approves it, but we can keep moving forward in that process if that seems reasonable to everybody. All right, Amanda Borup, I'm going to send it back to you for the next portion.
Okay, great. And then we had, before we get to the next set of questions, we had a presentation that was requested, Rep. Morgan, by Nikki on behalf of the Cannabis Industry Alliance. So Nikki, are you with us?
Good morning. I'm trying to be. I am. Hello. Thank you. May I just dive in, Madam Chair? Chair Morgan, thank you. A presentation may be a bit of a strong description. I maybe will send some slide decks around, some slides around, or a mini slide deck around afterwards. But I think for this portion of the conversation, it was just pretty important that industry folks have an opportunity, and licensees and OLCC recreational industry have an opportunity to just lay out some background in terms of what our perspectives or what our thoughts are about some of these questions that you have to answer and some of the regulations that you have to answer. Potentially have the chance to change. I think one of the things that we are wondering, along with your other questions, is how does this jive in terms of the national market? What are we going to decide in terms of the outcomes and how that's going to interface and interact with what will happen? Certainly what was going to happen eventually, who knows when, after the national walls fall, so to speak. I would first like to say the Cannabis Industry Alliance is an organization that represents a very, very unified voice within the industry. That industry has put together some guiding documents, some guidelines and a document with principles around some of these cannabinoids and derivatives. And we're really steeped in a lot of the same shared values as the agency, looking at preventing illegal activity, looking at making sure that things intended for human consumption are reasonably safe. I appreciate, Representative Morgan, your nod to the Tide Pod challenge earlier. We can't always anticipate, but we should anticipate that what we do intend for consumption is done safely, keeping these products out of the hands of minors, helping consumers make educated decisions. A lot of this public safety and health regulation that should be reliable and evidence-based. So having kind of said that in a loose framework of the guiding principles, I think we want to look at what's happening in some of the other states in terms of CBN and CBG specifically in these products. As you all know, there are a few companies here in Oregon that employ a lot of people and produce a lot of product. That the end result is a CBN and a CBG product. And we're looking around at the country and seeing what are other states doing. Right now, in terms of just hemp, you've got 40 states where kind of explicitly allowed or permit hemp products. They're a controlled substance in 2 states. And of course, then in the question around sales of Delta-8 and THC, you know, it's not a product that we allow here in terms of sales, but we do allow it for manufacturing. And can we look at ratcheting down on some of that when it comes to Delta-8? The end result of a product, the CBN and CBG products that kind of come out of this, what we're calling artificially derived cannabinoids. Oregon's the only one, by the way, that is banning these products right now in terms of this national look. So when we start talking about it as artificially derived cannabinoids, I think we want to talk about some of the processes. But more importantly, the end result. Where can these products be sold? At this point right now, as you all know, they're being pulled off or have been pulled off of the shelves in non-OLCC retail shops, places like New Seasons, places like Natural Grocers. Those particular independent grocers are seeing a large economic ding, for lack of a better term, with the loss of those products. And retailers within the OLCC licensee have kind of anecdotally been sharing with the Alliance that we're really looking at a dip in those product sales as well. This is obviously public health and safety first, but a real economic argument. These are companies that employ a lot of a lot of employees and good living wage jobs. And if there is a way that we can start looking at one system and one regulatory structure, but still allowing for some of these products that, while some may say are intoxicating or some may say they are not psychoactive, I don't know. That's going to be a question for the task force in terms of definitions and terminology. But we certainly encourage some thoughtful rethought, re-examination, and some thoughtfulness around what those end products could be here in the state of Oregon for sale, both within and without the system. But we do also just want to plug the one plant, one system mantra in terms of regulation from the industry perspective is an important one. That was a bit of a roving commentary there for a few minutes, but I do appreciate the opportunity and ask that this task force and some of the recommendations that you're going to be making to the legislature will contemplate what that looks like at the end of the day with products for CBN and CBG.
Thank you, Nikki. Anybody have any questions of that or comments related to that portion? Okay. All right, I want to process. We'll get back to that. I appreciate that feedback. I guess as a non-cannabis insider, I remember somebody saying one's brain, one's body, or something like that. Or no, that was CBD, CBN. So are they all produced from OLCC licensees? Are they produced by hemp licensees? Are they produced by both? Intoxicating in different, how do you label the intoxicant format or the the outcome of product other than THC? How do you measure for levels of different portions of the cannabinoids and such? And so I guess I'm wondering who should be looking at that. Is it an OLCC thing? Is it an ODA thing? Is it as a whole just industry thing?
I can jump in there really quick, just with a couple definitions from House Bill 3000. There was an adult use cannabis item, and those adult use cannabis items would be the intoxicating type items. And then there was a second category for artificially derived cannabinoids, which are the ones that are usually taken with a CBD, and then it's changed to make it into another cannabinoid in like a lab. So an adult use could be artificial, but it doesn't have to be. And an artificial could be adult use, but it doesn't have to be. There's two kind of separate branches there. But what we've been seeing, as far to answer your question, the products are or were made inside our system, were made outside of it in the general system, were made from hemp handlers or those secondary processors. So as we all know, before House Bill 3000, the whole Delta 8, just using that as an example, was kind of just out there for everybody to be part of if they wanted to.
Well, and I think looking at the agenda, this is a good lead into the next topic. And so looking at it, it's changes to state law to support the regulation of intoxicating cannabis-derived products and artificially derived cannabinoids. And essentially, we have some questions to lead here, but looking at, we have still some time in the meeting today, though I don't know that everybody, I mean, how far we go in this conversation. But there's 4 questions there. So Amanda, if you want to lead us kind of through that, I'll pass it back to you.
Yeah, definitely. So this is kind of where that whole labeling conversation comes in again. So should hemp products be required to comply with label requirements like marijuana before being sold to consumers in Oregon? If you guys don't think that they need to be that strict of labeling requirements, would there be minimum standards that would be appropriate? And then kind of hand in hand with that is what agency would be responsible for setting those requirements and taking the administrative action on violations. And so really just any thoughts on the subject. I know we all have a lot of thoughts on labeling.
Well, let's take that one first. Amanda Metzler, go ahead.
I think that the labeling needs to be exactly the same as what it is for OLCC recreational cannabis. And I also think that OLCC should do the enforcement on that.
I would ask, what does that look like? OLCC labeling, right now it has by, what do you call it, per serving, of sorts and requirements like that, or what's different about what OLCC does that you like?
Representative Morgan, the thing that I like is the track and trace where there's accountability for it. So putting a label on it without having any ability to trace it doesn't. And while they are going to work on a track and trace at ODA, which I don't disagree, the system is already in place through Metric. And while Metric might not be the best, there's an RFP coming up for that as well. So this is something that could be brought into it at the same time, Representative. If we were going to bring hemp over, that it could be created into the RFP to handle what they would need, which would be maybe something different, batch tagging of plants and things of that sort. But any sort of processing that's happening, the oil should be tracked through Metric and tested to be able to know what's coming out is what's in there. And that's what the OLCC system allows.
Thank you. I am wondering if anybody else, Matt, go ahead.
Yeah, just curious. So would that apply to every product sold in the state, or just those manufactured in Oregon? Because otherwise, if it's not consistent with everything sold in the state, it just moves all the manufacturers out of the state to avoid the onerous process.
I think that would be a legitimate thing to require as part of the process, that anything that would be sold or consumed in Oregon or manufactured and processed in Oregon all come to the same standard. Sunny, go ahead.
I 100% agree with that. One thing that we would have to keep in mind is marijuana is not sold outside of the state. And so those products that are in Metric, how are they going to get out of Metric and be sold across state lines? I think it's totally doable, but that's something that we need to keep in mind.
Looks like a perfect time for Director Marks. And Amanda, is your hand up on purpose still? Okay.
Yeah, I just note that, Congress did introduce an act recently, the Cannabis Administration and Opportunity Act. I'm not saying it's the end all be all, but we begin to see in that act track and trace included for a diversity of products, some of the testing. So I think we're going along the right lines. We can provide this task force, I think, with some level of analysis of what that act does. I think, it's very early on. It's not likely to pass, right? We all, I think, are very aware of that. But I think it has some markers about what we should think about track and trace, how the commerce system is going to work between states, and how we can have a handoff from a tracking system to either another state's tracking system or potentially a federal one. I'd note that the federal legislation mentions tracking. I can't tell you exactly how it hooks up. I'm forgetting and not remembering, but it's in there. So they have a lot of these components that we're discussing. So I just think we're on the right track here is what I wanted to say. And thinking about pulling together certainty around testing, labeling, some level of track and trace based on intentionality. I think the ultimate question in the system development is who really sets the standards for all of those things, or the minimum standards between the states and the federal government, and how does that governance process work? And right now, in my look at the legislation, at least from my biased point of view, I think it farms it out natural pieces to natural federal agencies, and lacks what we've seen in a lot of states and what we've gone through, right? It lacks coordination, it lacks some dominance, some way everyone has to pull together to set the standards, and someone to call balls and strikes between all of those agencies, because, you know, we've never, we set standards. We don't always say our standards are safe. We say we have a standard. It's based on safety. It's based on human judgment. It's based on input of scientists and stakeholders, and a lot of the things that we've come to. But you got to have a way to comply with them. So I just would commend us to look that direction as we're looking at what we do, because, you know, we want to save our energy and step to match it up, and I think emulate what might be right for cannabis regulation and safety and commerce, if we look at that. So I hope to be able to provide you some, at least, there's a lot of analysis going on the act, whatever is out there nationally, to make sure this committee has an awareness, and anything that Canada Association has. And Steve Crowley, of course, is doing a lot of work for us and the team in evaluating that. So we'll make that available.
Okay, thanks, Director Marks. So I think in answering the question, should cannabinoid hemp products be required to comply with label requirements like marijuana before being sold to consumers in Oregon? I'm hearing the answer is yes. Does anybody have a different opinion that needs to weigh in? And are we looking at what the minimum standards are, or would the recommendation be to have that establish of rules? As a legislator, I really don't like just having agencies establish rules. I want there to be counterbalance in that process. At the same time, sometimes the nuances of getting everything right in a bill to make sure that we can do that in rules is appropriate as well. But is that the recommendation? Director Marks, go ahead.
I would absolutely not recommend that it go in statute. There's so much changing landscape here. The science changes. It is slow. Legislatures should hold regulatory authorities accountable for the decisions they're making under the regulation, but I would not primarily put that into a statutory framework. And I think we're seeing that Washington just went through that debate where they got stifled in regulating these things. I mean, we've seen that play out in a few legislatures. We've seen differences in what's regulated by, you know, the moment of statutory creation here. So, you know, maybe one state's picked up 3 items and the other state's picked up 5. There needs to be some ability to adjust along the way. So I would argue strongly that you vest that process of doing this and accountable to the legislature, agency, commission, and then hold them accountable for the decisions they make along the way. It's just moving too fast for statutory construction to continue to evolve with us or the science. I'm arguing that, I believe that, but it's up to the legislature to judge that. So.
Well, and I finding balance is necessary. So some states have administrative rule committees where the administrative agencies come up with the rules, but they have to kind of make their way back through the legislative vetting that did it meet legislative intent. I know Oregon's not there, but in my heart, we would have that balance of the distinguishment of the bodies. But I do think that I would almost recommend, and I could be wrong here, that a minimum standard should be legislatively listed, not necessarily in numbers, but in what the intent of what the minimum standards would be. That an intoxicating substance, that whether processing here, there, wherever, that anything that adult use or artificially derived meet a minimum standard of safety for consumption and intended target or audience or something like that, that there be some framework of the minimum, that it be established legislatively in that way would be my recommendation. I'm open to other suggestions.
I'll just note, as a part of a intensive gubernatorial legislative agency rules debate, and you do approve our rules. You just do it in group when you come into session. So there you go.
Yeah, fun stuff. Okay, so anybody have any other thoughts on the minimal labeling standards of what we would recommend that staff bring back, maybe in language that we refer to the big group? So then I'll move on to the next question, which is which agency should be responsible for setting label requirements and taking administrative action on violations? I think my first input on this would be if there's a violation of the labeling, it's more likely to be a violation of not including an intoxicant, of which the adult substance or the intoxicating substance is what we're trying to make sure is labeled appropriately for, which falls under the OLCC category of responsibility. So to me, it seems like a natural fit that OLCC would be the enforcer, because somebody having a product that has no intoxicant, has no means of harming or causing an outcome different than what somebody anticipated, isn't necessarily what we're looking to enforce, correct? My thinking could be off on that. I would love some feedback if there's any other recommendations there.
I just hopped in without acknowledgement. I didn't get my hand up. We do look at other gunk that goes into these products, right? If it's particularly on synthetics, right? We do care about things other than just intoxicants. We care about how it gets made. So I just wanted to add that to your consideration. I'm not sure what my answer would be for all products across, I think your good line on intoxicating on the CBD market is where we're really looking for the marker there. The rest of it would be more continued consumer safety oversight for the regulatory structure. Maybe intoxicant works as our marker.
Sunny, do you have any comments on the ODA perspective on this?
Yeah, I think, right now OLCC has the most experience with labeling requirements. So, if that was to come to ODA for hemp products, we would have to look to the work that OLCC has done and the work that FDA has, which is what a lot of the OLCC labeling requirements are based on. So I think, if you're looking at a duplication of efforts, that might be problematic. From an enforcement perspective, it gets really tricky if one agency has the rules and regulations and then the enforcement is split or separate from that. I think we're already seeing that with a few other things. I know I get a lot of calls from the industry and it's getting really confusing as to which agency does what. And so I think anything that we can do to simplify that for the industry would be very helpful as well. So those are kind of my thoughts off the top of my head.
I appreciate that. Thank you. And I think we need to, it would probably be appropriate for us to revisit who goes where, and is that something that the task force needs to make recommendations about? Amanda Metzler?
Representative Morgan, Sunny actually hit it directly on the head on what I was going to say. The duplication of things that are already happening at OLCC to have them happen at ODA seems an unnecessary use of resources and reinventing the wheel when they already have that set in place.
So I don't know if we're prepared for the next question, but I'm going to throw out the next two bullet points that are there. What are the impacts on agency capacity if enforcement is increased? Actually, I think we can. We have both ODA and OLCC and OHA here. If increased enforcement is asked for in your agency right now, what is the impacts on capacity, or what capacity do you have if increased enforcement on labeling, testing, tracking, tracing, all that is there? Sunny, do you want to start, or do you want Director Marks? Go ahead, Sunny.
Yeah, I think it depends on what you would be asking ODA to do. So, if the labeling is through OLCC and you put the enforcement there, it would be very minimal for us. We would just be referring, any potential issues that we saw in the marketplace. For example, Brent brought up our food safety and scales staff. Right now, if they see something that looks egregious, we make sure that we're letting OLCC know. So right now, for example, our food safety staff do look at labels, for example, of marijuana products. And if they see something that's a violation, either from a food safety perspective of not listing a allergen, that's a pretty common one. But because the current OLCC labeling requirements mirror a lot of the federal requirements for food products, our staff are kind of perusing those and making those recommendations, forwarding those concerns to OLCC. So if it was housed within OLCC, I think the addition to ODA would be pretty minimal. We already have an IAA with OLCC and those agreements in place. Amanda and I talk, or David, Anthony. So I think that we already have that in place. Obviously, again, if ODA was doing the enforcement, that would be a pretty big lift, and you would see a pretty big increase in hemp license fees to cover that additional enforcement need. I would say, and I'll let Steve talk about this, but right now, as I understand it, ODA or OLCC has one person reviewing labels. That would need to increase because I know the industry, you have two, okay, but the industry would be pretty frustrated if there wasn't a good timely turnaround on those label reviews, especially implementing it from scratch. There's going to be a pretty big lift from the beginning. I mean, we saw that when we moved from the medical to the adult use program back in 2016.
Absolutely correct. Nothing in adding regulation. Should we be slowing down the ability of people to get their product to market, legitimate product to market? So, Director Marks.
I'd say the question is really like symbiotic, right? How much you do in packaging and labeling changes the way you enforce and what you're looking for in the open market, right? Because if you had a product come out, it might have the marker on it, and cigarettes have a tax stamp on it, goes out, what the product is, it's been looked at by the state, it's been taxed by the state if it's taxable, that it's been reviewed, except for counterfeiting, right? Which is what would happen there. But to my mind, that is why we need these standards, to reduce the enforcement efforts that you have to do at the retail level in a very open market. If we don't do packaging and labeling, we do not have the resources to try to enforce the open market side. If we can distinguish these very good hemp products, by going through the packaging and labeling process, they show up, we're going to know those are the good ones, right? We're going to know. They might have a QR code on them. We'll know what they are. So it's reinforcing to good enforcement and to quality control to use packaging and labeling to get us there, to ease that. And then if these products are coming down from the internet, well, if they're showing up at the retail, they're showing up at the home, that's a whole entirely different beast to try to enforce against that. Not just in this area, but again, across, a diversity of product areas where the internet is creating legitimacy problems with products. So I think that, yes, we could have the resources to accomplish this work. We'd have to take a look and price what that would mean. Work with ODA on, how they license, have some, we got to look at the resources between us. We're getting pretty good on that. We're swapping resources. We haven't done it entirely. They do pesticide testing for us, right? And there's another part of our ongoing relationship. I think we'll have a discussion about how we pay for that directly in the future here. But I think we could minimize the resources through packaging and labeling, figure out what the costs are depending on what that system is. And I think you could say between what we do in the system that we, obviously have enough resources to provide oversight and enforcement of that. I'm not saying you might not need to give us new fee authorities or different parts, but I think we could contain it so it'd be an effective cost system.
I appreciate that. So the last question there, unless anybody has any more thoughts on that topic. OHA, Andre, did you want to get in there on that at all?
I'm sorry, Rep. Morgan, what was the specific question in the category?
That was if impacts on agency capacity if enforcement is increased, since you are one of the three legs of the stool.
Yeah. I mean, there's always going to be an impact on agency capacity, which would mean probably additional FTE, and then those requests coming before you and agencies asking for that position authority. So I think, yes, there would be capacity issues and agencies would just have to ask permission to fill those positions.
I appreciate that. Thank you. Okay, so the last question on the agenda today on this topic is, should the law address products containing artificially derived cannabinoids manufactured in Oregon and sold out of state? I think a few minutes ago, I kind of asked after, was it Brett that asked about products manufactured elsewhere and sold in our state too? My feeling is we should all be at the same standard, whether it be manufactured out of state, sold in Oregon, or manufactured in Oregon, sold in Oregon and out of state. Everything should be held to the same standard for the sake of not creating the loopholes we see in Southern Oregon with the growing regulations of the three agencies, right? Or but anybody else have any other thoughts on that? Jay, go ahead.
Yes, Representative Morgan. To that question, if we look at what the FDA will allow for the manufacture specifically for export outside of the U.S., I would ask that things we think about here do not handicap those entities that are producing said compounds for export outside the U.S. that would not be allowed to be sold in the U.S. The FDA does allow for this, and I would just make sure that there's language that allows for that, so the commercial enterprise could manufacture a compound even though it's not allowed domestically.
That's an interesting one to consider. So potentially we can create something unsafe for consumption as long as we're selling it out of the country. But FDA
Basically,
has standards too. I guess I'm just
no, not for this. Actually, the U.S. allows for export. If you can find a buyer outside the U.S. for your chemical even though it may not be allowed domestically, I can point you to these. There's a whole different groups that handle this. So this would be probably under APA, would be the exporter. There could be others, agencies, including USP, etc., that would be the certifier of that export of a compound that would not be allowed to be used domestically. And there's quite a market out there. We're not talking about
question for you on that, Jay. Yeah. So if it's sold internationally, can they in turn process that and sell it back to us under no standard?
No.
I mean, just like Brett asked it wasn't Brett, I'm sorry. Matt, I think it was Matt, asked about if we have the regulations so staunch that in Oregon, they're just going to go over the border and process it over the border to sell back in Oregon and create a loophole. does this also create a loophole internationally that I just have to ship my product to China, they can make whatever they want and they ship it back? I mean, I'm asking because the legislature did in the 2021 session address toys made in other countries that are sold in Oregon that would not meet the standard that Oregon would want. And we dealt with this legislatively to make sure that we're not selling unsafe products in Oregon, no matter where they're manufactured. So if a product that we created in Oregon were sold to somebody internationally and then brought back to Oregon, I guess I'm just asking for dialogue's sake. I'm trying to understand.
Sure. So illegal import, of course, can occur, but if we're looking at it under a legal, no, it wouldn't, because it would be illegal to be imported into the U.S. Right. So it's depending on what border crossing you're looking at, Delta 8 is likely going to be intercepted, but it will depend on that. So if you're concerned about that, something that went out as, say, manufactured in Oregon went out as Delta 8, well, if it somehow legally got out, that would be interesting. But if they did get an FDA, along with probably an EPA permit, I'm just saying, you know, statutorily, this could happen because we've explored this loophole. That's why I'm bringing it up. A loophole being that could we see an export of something that's disallowed and then it comes in because the Fed isn't paying attention to it, right? So that, of course, that's possible. But as far as the legitimate business movement of material, it could only go out. It would not be, it will be an illegal importation and will be seized, obviously, by Customs and Border Patrol.
Thank you for that feedback. I think ultimately, as an Oregon legislator, my goal is to protect Oregon licensed businesses. And I know that it's federally not legal for me to tax other states' commerce over ours. But I, at the same time, want to make sure that I'm protecting our businesses. And so I appreciate the dialogue. I believe I have Amanda's hand up. Metzler.
Thank you, Representative Morgan. I would actually like to advocate for a ban on the manufacturing.
Amanda, I have you frozen.
Can you still hear me?
Oh, now I can. So it stopped at, I would like a ban for, and then I didn't catch anything after that.
Ooh, that's a little hanger there. Can you hear me now with my camera off? It's probably better.
Yes.
Okay, great. So I would like to advocate for a ban on the manufacturing of Delta 8 in the state of Oregon, not just on the selling of it. This, along with the FDA, says that there are some issues with it. And if we are protecting consumers here in Oregon, why would we be manufacturing just exactly what we were saying to send it internationally to also be manufacturing Delta 8 and then selling it outside of the state as well?
Are there other folks that have comments on that? Matt?
If I recall, the legislature called for a regulation of Delta 8, not a ban, and which also goes back to the earlier discussion about legislative intent and rulemaking. And it would seem to me that Delta 8 maybe isn't necessary to ban it, but let's go back to the original legislative intent and regulate it. At least that would certainly be my preference.
And I appreciate that, Matt, because the intent was to, it was definitely to regulate it, adult use and all that. I think the question is, how many, if it is regulated, it needs to be regulated through Olcc. Thus, do you have a hemp license to do that, or do you have an Olcc license to do that as a artificially derived intoxicant or a well, essentially that's what it is, and with the Olcc being the regulator of that. So if it is regulated, everybody, I mean, through the same system, I don't know, that's discussion to have, because the benefit has been you can have an ODA license to grow hemp, but the intent of what's being sold is an intoxicating or artificially derived cannabinoid, which is now through OLCC regulation. So I don't know. I think to me it asks the question of how many people involved in the regulating. But you're right. We did not say ban it. We said regulate it. But I also know under the hemp farm bill, the intent wasn't to have intoxicating out of hemp in the federal farm bill.
Yeah, I don't have a problem with OLCC regulating Delta 8 as they do Delta 9. I don't think it needs to be banned. I think it has a place. I think it has some medicinal properties that may or may not be useful. And like I say, if you're going to regulate Delta 9, why not regulate Delta 8 the same and allow the manufacturer? I know it's probably the single biggest user of CBD isolate right now is conversion to Delta 8. And I think, maybe take a look at the testing to make sure it's safe. I know there's lots of different processes in conversion to Delta 8, which some of the chemicals used, I would certainly question, but I'd say regulate it and keep it safe. If you ban it, it's still going to be there, only now you're dealing with an unsafe black market.
Sorry, I was writing notes. Thank you, Matt. Amanda.
Representative Morgan, I think that if we continue on the legislative intent at the federal level, the legislative intent was never for hemp to make intoxicating products. So allowing Delta 8 to continue to be manufactured in Oregon is creating a legislative intent federally. So we cannot cherry pick which legislative intents we want to take. If we wanted to be FDA for this and not for this on the hemp side, it was not supposed to be intoxicating, and Delta 8 is 100% an intoxicating product at 100% competition with an already pre-existing industry here that grows intoxicating products.
I know there was an article that came out a while back about the Ninth Circuit's decision on this, and I don't remember what the outcome of that was. As far as
it allowed Delta 8.
Okay, so
it found Delta 8
and Matt, your
legal.
hand's back up. Sorry. Go ahead, Matt.
Yeah, the court found that Delta 8 was legal, and with regard to legislative intent, if you're going to go Oregon legislature versus federal, then you would make marijuana illegal again.
I think from my standpoint of observing from the outside would be that you had one that was meant to be agricultural and non-intoxicating. You have one system that was meant to be intoxicating adult use, and you have another that was meant to be medicinal of sorts. The medicinal has kind of been forgotten in the process, and I know we haven't really been dealing with that, though I really appreciate, Andre, you here representing Oregon Health Authority. But if the legislative intent of legalizing hemp federally and having it be an agricultural product, producing the fibers and the other products that's there, if the intent is for the CBD production for the sake of the Delta 8, should that be in the ODA system at all? Or should it be everything in the OLCC program for the sake of apples to apples versus apples to oranges? I did mean that as a question, not just rhetorical. Director Marks, go ahead.
I'll just pipe up. So, I think it's really important that we stay right, that we try to create that level playing field for what we got, and particularly paying attention to safety. I'll just note, with synthetics, we are allowing on the CBN, we're looking to find our way to as to whether it can be generally recognized as safe over the next 18 months. And I think that kind of science evaluation is vitally important. The playing field is kind of skewed between, I just want to talk about the playing field just for a moment, between, we allow 1 acre of marijuana versus, indefinite acreages of production of biomass, hemp, CBDs that can be converted. There's an economic issue there on, parity. And then I think Matt's point is really important, that the illegal market will take over on some of these things completely if we don't think about how they are in the boat. But I think where we're at today is we haven't equalized them. I do think they need to be synthetics on the, if marijuana is go low and go slow, they're there. We haven't done sufficient work on our own marijuana, THC, intoxicant standards, packaging, labeling alone. And now we're trying to get a handle on the safety of synthetics, which seems like whack-a-mole right now. So I think there's commendable reasons to think about it. I just don't think we're there regulatory yet, both in equity in the playing field, and then just our ability to reach out and capture the safety analysis that needs to be done with so little information.
So follow-up question for Matt. I mean, if regulation is there, and based on what Director Marks, as a hemp licensee, I mean, obviously it's easier for you guys to grow in mass. There's no limit to how much hemp you can grow. Based on what you just heard, any feedback on that?
Well, it's kind of the way industries go. I mean, you got that can be converted to an intoxicant is kind of a natural transition. Went from building cars by hand to Ford's Model T, which was mass produced. I mean, it's like with any commodity, any product, if you can figure out a way to make it cheaper by mass producing, it's just kind of the natural transition. It's going to happen, whether you regulate it as a legal market or whether you try to ban it and the illegal side takes over. I mean, I'm seeing right now, just on the marijuana side, there's a heck of a lot of black market stuff because of the tremendous amount of regulation on the legal side. The hemp industry right now, the markets are such that guys are using hemp licenses to manufacture marijuana simply because there's no market in hemp at the moment. And so it's, people are going to follow the path of least resistance. And, what's most economical.
Just for a bit of a rhetorical, if I can just Matt, I mean, a bit of a rhetorical question, right? But if we go along the lines of it's just about mass competition, what about if I allowed unlimited acreage for marijuana, right? Would you be growing hemp at all? And would Delta 8 be a product?
Well, I mean, quite frankly, I have no interest in the marijuana industry. I've never tried it, never used it, don't have an interest in it. But from the standpoint of mass production, you're seeing lots of pretty good sized marijuana operations. Hemp is such that it became too easy. In 2019, U.S. production was about 500,000 acres, which was 25 times the annual consumption for the U.S. And so we overproduced, and the price it has no value at the moment. Which, I mean, it's just kind of it's a commodity like anything else. It kind of comes and goes. But same with marijuana. They've overproduced a lot to where the price of that has gone down, and which was the intent of legalization, was to put the black market out of business. But you also have to couple that with regulation that makes it such that there's no market in the black market or no money in it.
Thank you, Matt. I think from my standpoint as a legislator trying to find, we've so overregulated the overproduction of marijuana that we've limited how many licenses, we've limited how much acreage, and they're supposed to be the intoxicating brand of cannabis. So without limiting on the hemp side, when the main cell you said is for an intoxicant, I don't know the right solution. I think Director Marks kind of hit the nail on the head of, do we go the extreme and say there's no limit to how much marijuana you can grow? Or do we say if the end product is intoxicating, everybody's got to be on an equal playing field, that it's regulated, it's allowed, but it's got to be on an equal playing field on how that process goes. This is a tough dialogue. There's a lot of investments at play on everybody. And so I appreciate the dialogue. Amanda, I see your hand up.
Thank you, Representative Morgan. I just needed to do a few fact corrections. Is that the influx of illegal grows in Southern Oregon is not because of an overregulated legal program. The influx of illegal grows in Southern Oregon was from an unregulated hemp program. We cannot be confused and let that get skewed. And an illegal hemp program with the production happening of illegal grows and illegal marijuana affects the legal market on the price. It is not just because of an overproduction happening in the legal market. Matt and I will see differently on this, but there are two sides to justify that. And also, it's getting very exhausting for current OLCC licensees that have been here since the beginning, 2015, to hear hemp industries say the only way they can survive is to make intoxicating products. Then you are in the wrong industry, because that is not what it was made to be. There is a pathway for intoxicating products, and we cannot allow an industry to come in and take over making intoxicating products because their only justification is they can survive by making intoxicating products. So we're just getting a little exhausted on the legal side and the OLCC licensees of listening to that talking point when you want to create a 100% competing market. Matt, you don't want to grow marijuana, but you're willing to grow hemp.
Hold on, Amanda, I don't want to direct an attack towards another member. I'm going to interrupt there. But I do hear you. It is competing, and we have seen the markets impacted by, there was a green rush on Southern Oregon. Everybody thought that if they got into the growing industry, everybody would make a lot of money. We had people in industry say this is going to be the solution for any of our law enforcement needs. We're going to have enough tax base. We're going to have all these other things to support all this product. And so many people grew that the market fell out underneath. And you're right. So saying that we have to do this, I'm going to add one more piece to that. Yes, it is why we started on the House Bill 3000 bandwagon when we started that bill was because of the hemp process, and anybody could get a hemp license and cover the legal black market. And I appreciate the partnership with ODA and OLCC and helping us work with our other community partners in the enforcement there. But I'm going to say the federal limitations are also the thing that's driving the market, and in the black market is, look at Ontario's OLCC dispensary that is the highest selling in the state. Look at the highest selling liquor retailer in the state is right outside of a dry bait or tribe. So it's kind of one of those things that we are going to be impacted when federal legislation changes and cannabis legalizes federally. And I am curious what the products will be when it is legal federally. Is Delta 8 going to be what people go after? Or is it going to be that anybody can get any form of THC in cannabis and it's now legally to transport and get it across state lines, and it's not going to be a necessary product to get that intoxicant? I think there's a lot of questions at play of what happens when Oregon is able to provide the products that we create here in other places legally. And right now we have one industry that is able to do that through the Delta 8, while the other is not and has been under regulation longer. It's not necessarily an equal playing field. And I don't think, I heard it this last week from legislators across the country and even in Congress of the hemp program was not meant to be the intoxicating arm. And that's why it legalizes a farm bill. It was meant to be all the other things. And so I understand this is, it is important for us to have both industries represented on all these subcommittees and the greater task force, because I know you're all being impacted by what we decide. But it is not an equal playing field right now. And we definitely have one that is, but federally, when this goes legal federally, how is that going to impact Oregon? How do we have regulations in place in Oregon that protect our licensees and our manufacturers, producers, that we have a market federally that's also safe and not just keeping, I mean, let's switch just a different product that's intoxicating right now. We have unsafe product coming across the border in the form of fentanyl coming in. I mean, we have Oregon Health Authority putting out warnings. Do not take any pill that you didn't get from your pharmacy and you know exactly the source, because our overdoses are so out of control and people are dying on the streets literally at an horrifying rate. There is a reason why you have to have consent, informed consent on what you're buying, that you know that you're getting a product that's safe for consumption, that it's to your appropriate level of being able to handle it. Why adults are able to make that decision with intoxicating beverages and substances where kids are not able to make that decision. And I would love for Oregon to be that safe place to have product that is providing for the country in a safe manner. I have been advocating for interstate compacts that we can have licensed Oregon retailers sell to other licensed retailers in other states. I've been advocating for safe banking. I absolutely want to protect our industries. But it's not apples to apples right now. And so, I mean, to be fair, so Director Marks, I'm going to skip to you.
I just want to make a point that we have experience equalizing the playing field. We did it with indoor and outdoor growers, right? That was quite a debate when we entered the system, right? How much would you get of each thing? How did that work? And we actually had like a 4-to-1 ratio. And ironically, right, you may recall, the legislature didn't impose the standard in the end. They left it to us, but they debated the standard, and essentially we did the standard that most of them were talking about doing on that. So my point is, you know, if you wanted to bring in a hemp acreage to produce an intoxicating product, you know, what would we could come up potentially with a system that regulate that acreage under the kinds of standards that we have in the production to do it, to make it. But that's how we, you know, equalize the playing field between indoor and outdoor and then mixed use ratio. And quite frankly, I'm not sure we got it right, but it is normalized, and I never hear a complaint about it any longer that it's wrong. So.
I hear you. So I need to pause our conversation because of time. And I hate to do it because we have, it's emotional. It's a lot of information. It's important that we, well, we value all of you and all the industries that are represented here. And we want to make sure that we have these conversations, but we do need to continue it in the next meeting. And I do know that we intend to invite the labs, and we want to have that conversation about the reference labs at the next one. We can continue this conversation. Feel free to email Amanda Borup and myself if there's other feedback that we need to get going there. But I also just want to point out in the agenda that Amanda Borup sent out, there is some of the resources of the current OARs, and as far as where the rules currently existing, there's also a white paper there and kind of just what the current testing status is. It's, I hope that we can come to a point that we can have something that we can build consensus on to make recommendations back to the full task force. And the full task force will be voting on all of this. And so I really appreciate the dialogue today, and I appreciate everybody taking the time to give us 2 hours to have this conversation. So Amanda Borup, I'm going to send it back to you. Is there any other administrative tasks we have to wrap up before, and as far as I'm not sure when our next meeting is.
The next meeting is Wednesday, August 17th from 11 to 12:30. So it will be a little bit shorter. It'll only be an hour and a half next time. And then just a reminder to people that were non-task force members that were listening in, if you did have comments that you wanted us to hear about, feel free to email those directly to me. I'd be happy to collect those.
I know I have forwarded some to you as well that came to me in the form of recommendations, and so that we can have a time to try to get those incorporated into agendas as well. So I appreciate that. Okay, I am going to, with 2 minutes left, I'm going to wrap things up unless there's any last minute good of the order. Okay. Thank you, everybody. We're going to call this meeting adjourned at 11:28. We'll see you back on the 16th, and thank you very much.